Afternoon, everyone, and welcome to the second webinar in this double bill on the topic of antimicrobial resistance as part of the community engagement within research uptake series. So this event is brought to you by the Global Health Network and its knowledge hubs ARCH, applying research to policy and practice for health, and MESH, the Community Engagement Network, and of course the Antimicrobial Resistance Hub, AMR Hub. So I'm Dr. Alun Davies. I'm a social scientist and community and public engagement with health research specialist. I'm based at the Health Systems Collaborative at the University of Oxford in the UK. And I'm delighted to be joined today by Tasawan Pumchaichoti and Dravikanya Prafarsavat, both from the Mahidol Oxford Tropical Medical Research Unit, or MORU, in Thailand, and Makwelings Phiri from the Malawi Liverpool Wellcome Trust Research Programme in Malawi, and of course the Global Health Network team. So antimicrobial resistance, or AMR, is one of the most complex public health threats in the world, requiring coordinated efforts from governments, the public, and a range of stakeholders from different sectors. I've got some experience of working with colleagues in Okru in Vietnam, Moru in Thailand, Nepal, and in Kenya in establishing an international engagement platform called YAR, or Youth Against Antimicrobial Resistance. And through engaging with this group, with science teachers and curriculum experts across these countries, we've been able to develop an AMR learning framework, which can be used inside and outside of learning institutions to help plan learning sessions. But more about that later on in the year. On to today's webinar. So these webinars have sought to explore the role of community engagement within applying research to changes in health policy and practice with a focus on antimicrobial resistance. You heard from two speakers last week discussing the challenges of finding the right language to begin to discuss AMR with communities and policymakers. And today we'll discuss experiences of embedding public and community voices in an effort to co-create solutions to mitigate AMR in Thailand and Malawi. Our speakers will share their experience of implementing Wellcome's responsive dialogues approach, which uses participatory and deliberative processes. So the link to this toolkit is being posted in the chat. So this webinar session will last 1 hour. The recording of the last webinar on AMR and this one will be available in the location posted in the chat. Information on future events can also be found on the link to the Arch Hub in the chat. But just before I begin, I just want to run through some housekeeping. So firstly, this session is being recorded. The recording will be shared in the coming days on the Global Health Network, Arch, MESH, and AMR platforms so that you can have a look at the materials and share them. These materials can be found using the link that's just been shared in the chat. To interact with the panel, please use the Q&A function, which you can find in the toolbar. If you have any technical issues, please use the chat function and the Global Health Network team will assist you. If you have any general comments, please add them to the chat function. So we've dedicated time allocated for questions and answers, so we'll try and get through as many of these as possible towards the end of the session. So on to the speakers. First of all, we'll hear from two of the team from Moru in Thailand. We'll hear from Tasawan Pumchaichoti. She's a project coordinator at the Mahidol Oxford Tropical Medical Research Unit in Thailand. She has a bachelor's degree of nursing and a master's degree of science and public health from Mahidol. She has experience of working as a research nurse and project coordinator for the clinical trials and community engagement in rural Thailand. She's currently working as the project coordinator of the AMR Dialogues project in Thailand. And secondly, Dravikanya Prafarsavat. She's a social scientist at Moru in Thailand. She has a bachelor's degree of biomedicine from Mahidol University in Thailand and a master's degree of international health from the University of Tokyo in Japan, and the Department of Community and Global Health, focusing on tuberculosis and migrants in the Thai-Myanmar border. Currently, her work is focused on antimicrobial resistance, especially in promoting awareness of AMR. Her projects include the AMR Dictionary, Antibiotic Footprint, Antibiotic Footprint Calculator, and AMR Dialogues. Over to you, Tasawan and Ravikanya. Thank you.